Your kidneys have been caramelizing for 10 years. You have not noticed. If your fasting blood sugar has been over 100 for more than 2 years, if your last A1C came back above 5.7, you are already on this ladder. There is a 7-stage ladder inside your kidneys, and you cannot feel it. You can still walk away clean from stage 4. Stage 7 is different. Stage 7 is a waiting list, a permanent vessel cut into your forearm, and a 5-year coin flip. This is how your kidneys slowly caramelize themselves in 7 stages. Stage 1 starts the first year your blood sugar runs too high too often. Your kidneys are not filters in the everyday sense. They are a precision sieve made of 1 million tiny tufts of capillary called glomeruli, each one wrapped in a thin membrane that is supposed to let water and salt pass and hold proteins back. When your blood sugar runs high, those membranes start to glycate. Sugar molecules bond chemically to the proteins of the membrane and never come off. This is the same chemistry that browns a steak in a hot pan, the Maillard reaction. Proteins meeting sugar at temperature. Inside your kidneys, the temperature is your body's. The sugar is your blood. The reaction is slower, but it never stops. In stage 1, the body compensates by filtering harder. Each glomerulus pushes more blood through to try to make up for the others that are stiffening. Your eGFR, your filtration rate, actually goes up. A high eGFR looks like a good number on a panel. It is not. It is your kidneys running over red line. This is the part nobody flags. You feel nothing. You feel slightly more thirsty. You feel like you have to use the bathroom more. You attribute it to coffee. You attribute it to age. Stage 1 is your kidneys quietly burning their reserves. But that is not the dangerous part. Stage 2 is the year the inner scaffolding of each filter starts to thicken. Inside every glomerulus is a layer of supporting cells called Mesangial cells, the filter's structural packing material. Around them is a soft extracellular matrix that holds the capillary tuft in shape. When the membrane is glycated and the kidney is hyperfiltering, the mesangial cells start secreting more filler. Think of it as scar tissue poured into the gaps between your filters. Slowly, the breathing room disappears. Here is what is supposed to happen. The matrix should stay thin. The capillaries should sit in open space. Blood should sweep past the filter membrane at speed. As the matrix expands, the capillaries are squeezed. The surface area for filtration starts to shrink. This is called mesangial expansion. It is the first structural change of diabetic nephropathy. You cannot see it on a standard ultrasound. You cannot detect it on a basic metabolic panel. It is invisible to every test your doctor orders at your annual physical. Roughly 1 in 3 adults with type 2 diabetes is already in stage 2 within 5 years of diagnosis. Almost none of them know. You feel none of this either. You feel a little more tired than your friends. You feel like your shoes are slightly tighter at the end of the day. You assume it is the season. You start a magnesium. Most of it does not help. Stage 2 is the chemistry of your blood quietly rebuilding the architecture of your filters. Most people stop here. Most people are wrong. Stage 3 is when the first protein starts to leak through. The filter membrane was never supposed to let albumin pass. Albumin is the most abundant protein in your blood, and it is too big for a healthy glomerular membrane. When glycation damages the membrane and mesangial expansion warps the geometry, microscopic gaps open. A tiny amount of albumin starts slipping through into the urine, and then the leak slowly grows. Doctors call this microalbuminuria. The test that measures it is the urine albumin to creatinine ratio, the ACR. The normal ACR is under 30. Microalbuminuria runs 30 to 300. Anything above 300 is overt proteinuria. Here is the trap. The standard yearly physical does not order a urine ACR. A regular urine dipstick will not detect microalbuminuria. The levels are too low. Your kidneys are leaking and your doctor does not know. The American Diabetes Association recommends that every patient with type 2 diabetes get an annual urine ACR. Roughly 1 in 3 actually does. The other 2 are sitting in stage 3 and no one is screening for it. Here is the part nobody screens for. You feel none of this. You feel a little foamy in the toilet bowl sometimes. That is dissolved protein bubbling on the surface. You assume it is the soap. You assume it is dehydration. By the end of stage 3, your ACR has crossed 100. The leak is visible in a lab if anyone bothers to order it. But most people at this point are doing fine by every measure they have access to. Their creatinine is normal. Their eGFR is normal. Their doctor is satisfied. They are sleeping 7 hours and they think the slight ankle puffiness at night is just how feet work now. Before we move on, 3 stages in, the membrane caramelized, the scaffolding thickened, the first protein leaked through, and here is the part that breaks people. The next 4 stages happen while your standard kidney panel still reads normal. Stage 4 is the year the leak becomes a flood. Here is the cruel part. None of stages 1 through 3 reliably shows on a standard chemistry panel. Your creatinine is normal. Your eGFR is normal. Your potassium is normal. You ask if your kidneys are okay. The answer comes back yes. This is the stage between 3 and 4 that most adults with insulin resistance live in for years. You feel slightly worse than you used to. You blame your job. You blame your age. You blame the fact that you stopped going to the gym. You glance at the foam in the toilet sometimes and you do not think about it again. And then it gets worse. Stage 4 is the year microalbuminuria becomes macroalbuminuria. Macroalbuminuria, ACR above 300. Now significant amounts of protein are leaking into your urine every day. The protein you are losing in your urine has to come from somewhere. It comes out of your blood. Your blood albumin starts to drop. Albumin holds water inside your blood vessels by osmotic pressure. When it drops, water leaks out of your vessels into your tissues. This is when the swelling starts. Your ankles are puffy at night, and you assume it is the heat. Your fingers feel a little fat against your wedding ring. Your face looks slightly different in the mirror in the morning. You assume it is sleep. What is actually happening is that your kidneys are losing 6 to 10 grams of protein per day into your urine, and your blood vessels are leaking the water that protein used to hold. The swelling is called edema. The condition is called nephrotic range proteinuria. A fibroscan would not show this. A standard ultrasound might catch enlarged kidneys, but nothing structural. A urine ACR would scream it from across the room. Most people never get a urine ACR. Stage 4 is the year your shoe size quietly grows. But here is what no one tells you next. Stage 5 is the year your filters start dying. Glomeruli are not regenerated. You were born with about 1 million of them, and once one is destroyed, it does not come back. Through stages 1 through 4, the damage was reversible in theory and structural in practice. In stage 5, the damage becomes histologically permanent. Inside each damaged glomerulus, nodules of pink hyaline material begin to form, round, glassy deposits inside the filter, named Kimmel-Steele-Wilson nodules after the 2 pathologists who described them in 1936. They are pathognomonic for diabetic nephropathy. If a kidney biopsy shows them, the diagnosis is locked. The number of functioning glomeruli has now dropped enough that your eGFR finally moves. It starts at 90, it falls to 70, it falls to 60. Below 60 is the official definition of chronic kidney disease. But here is the strange part. The eGFR drop is the first thing your doctor sees, and by the time they see it, you have already lost roughly half of your nephrons. The standard panel finally catches you, 10 years late. You might notice your blood pressure climbing. You might notice you bruise more easily. You might notice you are anemic. Kidneys make a hormone called erythropoietin that tells your bone marrow to produce red blood cells, and damaged kidneys make less of it. Most people in stage 5 make coffee on Sunday morning and assume they feel tired because it is Sunday. They sit, they blame the week. Nothing about how they feel tells them what a kidney biopsy would show. Stage 5 is a urine test and an eGFR away from being undeniable. This is where it becomes permanent. 1 year of caramelizing kidneys is a thirst you blame on the season. 5 years is a foamy toilet bowl and an ankle puff you blame on sleep. But 10 years is a kidney biopsy with Kimmel-Steele-Wilson nodules in every glomerulus, blood pressure that needs 3 medications to control, an eGFR your doctor finally takes seriously, and an A1C report that has been quietly above 7 for a decade. Here is where we are. The membrane caramelized, the scaffolding thickened, the protein leaked, the leak became a flood, the filters died. You are now 5 stages from the start, and the next 2 stages are when the kidney damage becomes a whole body event, and the body the kidneys were quietly cleaning starts to drown in its own waste. Stage 6 is the year the rest of your body finds out. A kidney does 5 jobs. It filters waste, it balances electrolytes, it controls blood pressure, it activates vitamin D, it tells your bone marrow to make red blood cells. When the kidneys lose half of their function, all 5 jobs start failing at once, and then the cascade hits. Waste products like urea and creatinine build up in your blood. Phosphorus rises because the kidneys are not excreting it. Calcium drops because the kidneys are not activating vitamin D. The bones release more calcium to compensate, which weakens them. Blood pressure climbs because the kidneys are not regulating it. The heart enlarges to push blood through stiffer vessels. This is called the uremic syndrome. Your body is drowning in its own waste, and it has been building for a decade. Your skin starts to itch in places that do not respond to lotion. Your appetite drops. Your thoughts get fuzzy in the late afternoon. Your bones ache without obvious reason. Your blood pressure needs 3 or 4 medications to keep it under control. The worst part is the speed. Once decompensated kidney disease is established, eGFR can drop 10 to 15 points per year, even on tight blood sugar control. You are not guessing anymore. Your blood pressure is high despite medication. Your hands itch. Your blood test results have a column highlighted in red. Stage 6 is the year your kidneys stop being a quiet problem and become every problem. But that is not the worst of it. Stage 7 is the final stage. Most people who reach it look unmistakably ill. eGFR has dropped below 15. The kidneys can no longer keep you alive on their own. Waste products that should have been excreted years ago are accumulating to toxic levels. Your body cannot maintain electrolyte balance, fluid balance, acid-base balance, or hormone production. This is end-stage renal disease. There are 2 paths from here. The first is dialysis. Before it can start, a surgeon opens your forearm and joins an artery directly to a vein, a permanent fused vessel called an AV fistula that you can see thumping under the skin for the rest of your life. That fistula is the access point. 3 days a week, you sit in a chair for 4 hours while a machine pulls your entire blood volume through an artificial membrane and returns it. Between sessions, you live inside a fluid cage. No more than 32 ounces of liquid a day, no bananas, no tomatoes, no oranges, because your kidneys can no longer clear the potassium that lives in them. The 5-year survival on dialysis is roughly 40%. The second is a kidney transplant. The wait list in the United States is about 3 to 5 years. During that time, you are on dialysis. After transplant, you are on immunosuppressive medication for the rest of the new kidney's life, typically 10 to 15 years before it too begins to fail. But here is the part nobody is told. The decade of stages 1 through 4 was completely silent. The only reliable warning was a urine ACR that nobody ordered. Most people who reached stage 7 sat with normal creatinine, normal blood pressure, and a foamy toilet for 10 years and never had the one test that would have caught it. This is what 10 years of a silent kidney looks like. This is the year, the month, the diagnosis. Here is the part no doctor will tell you. The damage is real. The blood work reads clean. The standard panel was never built to catch this, and for 10 years it did not. 7 stages: hyperfiltration, mesangial expansion, microalbuminuria, macroalbuminuria, cell death, uremia, dialysis. There is no warning in stage 2. There is no symptom in stage 4. There is no coming back after stage 7. The most dangerous thing about a dying kidney is that it feels survivable right until the morning a machine has to do its job. When was the last time anyone checked your A1C? Not a guess, the actual number. Tell me in the comments. Send this to a parent. Send this to anyone whose blood sugar came back a little high and who thinks that means they have time. Subscribe. The next stage of this story is your eyes, and the same 10 years of caramelized blood are quietly cooking the back of your retina right now for the same upstream reason.